So welcome to everyone. This is our first family forum via this method. Got the idea from a couple other chapters that were doing it, so we thought we'd give it a try. And we'll try to do this every couple of weeks just to keep people posted, get feedback from families. Things change so rapidly in this environment that it's probably good to have that contact. So a lot's happened since March 18th of this year, when we were informed that we were closing our day programs, which included all our day services, community pre-voc, day hab, and site-based pre-voc. And it's been a longer period than we originally thought. I don't think anybody expected this virus to be as aggressive as it has been in the transmission. But again, we've been very, very successful in protecting those people that we support. As of this date, we've only had 2 staff that were positive. We've had some that have been exposed, but ended up being negative. But we've had nobody that we support in our residences in any other places that I've heard that have been positive. So staff have done a great job of doing the protections that we put in place, wearing the mask, using sanitizer, cleaning as guidance provided. We've been following the standards in regards to temperature checks, questions related to the symptoms, it's just been a great experience so far in regards to maintaining support, safety for the people that we support. So very happy about that. So just a little bit about what's been happening. Our residences, of course, remain open, and we're operating our day hab services with those people that are in those environments. So we've taken our day hab staff and moved them to the residences to support the people in those houses. We've done very little other services other than up north in St. Lawrence. We are doing children and youth services with a few people, some respite and some day hab in small group settings with similar family groups. Other than that, very limited. Both our work centers have remained open, but we're not having any site-based pre-voc in those locations. It's only mostly staff that are providing coverage there, and a few other people, staff with disabilities that we have hired. So those are operating at minimal capacity, but the contracts still come in. And the reason we were able to leave those open is we are considered essential business. Those contracts in Jefferson relate to our Source America contracts, and we didn't want to jeopardize them because they're a huge part of our revenue stream that comes in. Our contracts on Fort Drum, the federal contracts, those have remained, and the people that we support that work out there continue to work in those environments, as well as that Wellesley Island contract we have at the border station in Ogdensburg and Messina. So those contracts have remained. They're considered essential, and the people have remained working in those environments. Since March 18th, we've had a lot of restrictions put in our place by OPWDD in regards to visitation. And I think one of the reasons we've been successful in maintaining this environment by providing safe environment is that we've been very restrictive in who can go to the sites. So the residences are only the people that normally work in that environment, and they have staff that are assigned are allowed into those sites. If we have other people going in to deliver goods or whatever, they drop them off at the front door and they leave. So we limited the number of people that go to the locations. There are a few people that go to one or two, but majority of our staff only report to one location. All the support staff have not been allowed to go in. And initially we did allow clinical staff to go in and do some supports, but decided not to discontinue that to try to eliminate the possibility of exposure. So that's been very successful. We've also limited visitation home with family members because we didn't want the exposure to come back to those that lived in the residences. And that's been successful also. However, families are able to take people home if they wish, but the person's gonna have to stay with them for the duration unless there's an emergency, and then we would have them tested. But we've reduced the exposure by not having that in place. We've got probably 5 or 6 people in Jefferson County that have taken their family members home and have kept them home. And I don't believe there's anybody in St. Lawrence that has done that. So The other areas that have been impacted at the organization, we have an Article 16 clinic up in St. Lawrence, and we have an Article 16 clinic here in Jefferson. Those have operated because we feel it's necessary to continue with OT, PT services. Down in Jefferson, we have OT, PT, and speech. Up in St. Lawrence, just OT and PT. But those clinical therapies are essential for the people that we support. So we have been taking those. There's people that are at risk, following safety precautions, one person at a time, sanitizing before and after their visitation. And I think we've maintained about 60 to 75% of our services in those areas, which are essential. We also run a preschool in Jefferson County. Of course, the preschool has been closed basically, and we've been doing telehealth and supports through telecommunication with those family members. We are operating a daycare in Jefferson at a very reduced census. How many's in there, Lynn, right now about?
About 12 we're averaging.
Okay. So we did open that up to family members. We let the Samaritan Hospital know that, you know, essential workers, we could provide daycare for them. We were not closed. OCFS supported us there. But again, the numbers have been relatively low for that. And our summer school sessions are not going to be taking place, although the governor has provided the option for school districts to implement that. We didn't feel it was in a timely fashion that would allow us to prepare for that to take place. So we're going to continue with telecommunications in that realm. So I'm going to unmute everybody. Does anybody have any questions related to what I said so far? Okay, so I'll continue and then meet you all again. So we've been working with the ARC of New York. We have regular meetings with them, and we were going 3 days a week. It's down to 2 now. They've been very assistive in a variety of ways, from advocacy to training to support. We also have regular weekly meetings with our regional OPWDD director and talk about what's happening at the state level. We've gotten a lot of our PPE, our personal protective equipment from the ARC of New York. Most of the equipment that we purchased initially, very expensive, and you have to order it in large quantities. So the ARC was able to facilitate getting all the chapters together in the state, and we ordered on a weekly basis, reduced our cost, and because the quantities were so high, it was effective to go in that mechanism. As of this date, the ARC has spent over $2 million on personal protective equipment for all the chapters. They are not going to be passing that cost on to us. They are going to apply for FEMA to cover 75% of those costs, and they got a grant to pay the other 25% from the trust in the ARC of New York. So we're very happy about that. We do have adequate equipment and supplies to meet our needs if we do have an outbreak or a positive exposure. We have a litany of equipment that's managed by our nurses in both Karen Jarvis up in St. Lawrence and Lori McGrath in Jefferson. They maintain all that inventory, and we will hand that out if needed. Every one of our staff members have been provided with 2 masks or more. We have the cloth fabric masks that we've been making. We have 2 staff that have been dedicated to doing that in St. Lawrence and provided a large number of masks for all of our staff. We've also had a lot of community members that have donated, made masks for us and donated. But we do have adequate surgical masks. We have adequate KN95s and N95s. We have face shields. We have gowns. We have hair nets and shoe covers if needed. We've also, if we have to, we do have isolation units that have been established. There was one in Jefferson, but we're exiting that building for renovation. And there's 2 in St. Lawrence if we decide to go that route, if we do have a positive. Instead of protecting in place, isolating in place or quarantining in place in a residence, we might remove that person to reduce the exposure to the other residents. Other chapters have been successful of doing it both ways, both isolation in the site, as well as moving them to an isolation unit. and Broome, Achieve down in Broome County. They have set up an isolation unit, which is available to everyone in the region if we needed to go that route. So I mean, I really can't emphasize enough the dedication of our staff. They've done a great job of covering our shifts for the people we support. Day has been covering a lot of our residential vacancies and working day hab hours also. They've been very adhering to the safety precautions we put in place. And I think that dedication as a result has resulted in 0 positive COVID-19 exposure in our residential sites in both locations. So you're talking 19 locations in St. Lawrence and 32 in Jefferson that serve well over 325 people. So I think that's a great accomplishment, and I'm very proud of our staff. We've been recognizing people. Our other staff, our support staff, have stepped up to the plate. We have utilized staff to deliver goodies, snacks, activities, boxes. Somebody's coming. There we go. So activity boxes have been provided to the sites to keep them active. And a lot of us, our support staff, have been engaged in that. I know that, overall, it's been difficult on some of our people because they're used to that routine. But overall, as of a couple weeks ago, we did an analysis of our incidents last year for a 3-month period and this year, and they've gone down 50%. So they're, I think it's a much more relaxed environment than it is getting up early in the morning, going to work or going to day programming. So, as we evolve into reopening at some point in the future, those are things that we'll have to consider. We were on a phone call with the commissioner this morning, and he did mention that, it's going to be a while before things do get back to normal, if they ever will. But he made the comment that, the day hab model of the past will probably not be the same as the day hab model in the future. There's things that we're going to have to look at. And Jefferson is a little different because we're involved in a renovation of our main facility. We are going through starting July 1st. They're going to be going through our building. It's going to take 12 to 13 months to do a rather large project. The building was built in 1968, and 72 an addition was put on, and not much else has been done to that building since. Michelle Carper has been leading that campaign, and we've been very successful in getting community support. And we were also successful in reducing the construction cycle from 18 months down to 12 or 13 by vacating that building all at once. So in Jefferson, we're going to continue with the day hab at home integrated model. In addition to our site-based, we have 2 smaller locations. We may look at repurposing some other space for that, but we've got to be cognizant of social distancing, how they're going to get there in transportation, and how we're going to maintain that there. So we'll be looking at how can we accomplish that? How can we make a smaller presence in site-based for those that need to be there, especially for people that live home with their family members. We want to make sure that they are provided with an option for continued programming. We'll probably be looking at, some people may choose to go into community hab or into community pre-bulk or some other self-directed option. But we're working with family members on accomplishing that over time. But I think we're a little ways away from that still. It's a little bit down the road, and recently we did a survey with family members, and 20% basically of family members, which was really kind of in agreement with all the other chapters across the state. They did the same survey with their day hab program family members and the people we support. And there's 20% of those family members and some people we support that don't know if they want to go back to that site-based model until there's a vaccine or until some other changes are put in place. So we're looking at a variety of different things to be able to do there. And those of you that, you probably know this, but yesterday, I believe it was, the governor came out with visitation will be able to be allowed back in the group homes. And again, the governor said that it would happen on Friday. However, no guidance was provided and how that's going to be prepared. So we are waiting for guidance from OPW. I got an email today that we do expect that to get that tomorrow. I think we'll be ready by Friday, but there'll be things that we're probably going to have to follow. For one thing, visitors will have to wear masks. They'll have to go through the temperature checks. They'll have to go through the symptom checks in regards to the questions asked if you traveled out of the country, been exposed, those kinds of things. We'll also be asking family members to call and schedule an appointment so we don't have everybody showing up all at once. We want to try to encourage visits take place outside if able to, and the weather cooperates with us, because we want to limit exposure as much as possible. If we do have to have an inside visit, we will isolate that person. They can either go to the bedroom to meet, or we'll isolate in a kitchen area or a dining room or somewhere else that we can try to limit exposure to the rest of the people in the house. We're going to limit the number of family members to 2 or 3 at a time. We're also going to look at one of the recommendations of the state. I did get some preliminary guidance, is that visitors have to be 18 or older. They're being recommended that take place. We still are not allowing any off-site visits this time. So those will still be limited. And if we do have a positive COVID and a mandatory quarantine in a location, visitation will stop for that location. We also have to maintain a daily log of who comes in and where they came, when they came, and when the visit occurred. The other thing that the agency has to do, so this guidance from the governor allowing group homes is not mandatory. The providers have the ability to say yes or no. We are going to allow this to happen because I've been getting a lot of phone calls, and 3 months is a long time to go without visiting with a family member, and we're aware of that. So we think we can put the precautions in place. We hope we'll be ready by Friday. I'll know more tomorrow, and then we'll get the information out about who to contact. Contact the house, set up an appointment, and we'll schedule families to start being able to visit. We have to sign an attestation with with OPWDD that we're going to abide by all this guidance, and that we're going to provide them the ability to look at the logs if they request them, and those kinds of things. So I'm going to unmute everybody for a minute and see if anybody has any specific questions. All right, everybody's unmuted.
Yeah.
Anybody have a question?
Are you saying that we'd have to make an appointment to go see a resident?
Yes, because we want to make sure that multiple family members don't show up at the same time. So
Okay.
we want to limit exposure. That's the only reason, so we can control the flow of traffic in and out of the house. Because that's, I think, one of the key things that we've been successful at in maintaining the virus, is we've limited that flow of visitation, even from staff.
What about testing the staff? I know for the nursing homes now, I think they're getting tested once a week, and they're through this whole thing. I mean, our people have done great, and there's no denying that. But when starting to open, I worry about that.
So we do have the ability to test. Well, I should rephrase that. The staff do have the ability to get tested. I would hope that the governor doesn't make it mandatory for us, because the cost is borne by the organization, and it would cost us $335,000 a week.
Oh gosh.
If we went once a week. I think his delay in opening up to family members to the group's homes has been related to what happened in the nursing homes. So I think one of the things we will be encouraging staff to do is the antibody test to see if they have been exposed. It's not as expensive. The only way that our insurance will pay for the testing is if the person's been exposed or is showing symptoms. We've had difficulty. We did have staff that wanted to get tested, but both counties at the time, a couple weeks ago, said that they didn't have the capacity to do that, and they would only do that if they were symptomatic or they had been exposed. So we're waiting for more guidance on that. We're hoping the costs come down and we'll look at that. But at this point in time, we're not doing mandatory testing of our staff.
Yes, Kathy.
Ellen,
Oh, Ellen.
can't hear you. Are you muted? No, you're unmuted.
It says she's muted on mine.
No, it
She may
says,
have to unmute her own line.
Yeah.
How,
okay. Ellen, can you hear me? Can't hear you.
Yeah, she's getting 600 plus the money.
she needs to push her microphone with a line through it. Howard, just for information, I did check into getting tests for my brother-in-law if he came home, and they have to be ordered by the doctor.
Right.
The locations in the county will not do it, and most of those are only if they're symptomatic.
Right. Yep, same thing we found.
Same thing Mary said.
There you go.
No, Ellen, you can go down to the bottom and the chat. Can you see the chat in the bottom? You can type your question in.
We're almost there.
Yeah.
When are we going to bring staff back to at 100%?
Well, the only staff that have been furloughed are mostly the bus drivers and administrative people. No other direct support or support person unless they voluntarily said they didn't want to work because of the COVID-19. So there's not a lot of staff. We have started to bring back a few. As we reopen, that's when we'll start looking at bringing back some of the support staff, but it's mostly bus drivers and transportation that we laid off. I should furloughed, not laid off.
I'm a secretary and have been laid off, so I was just wondering when I was going to come back.
It all depends on when the program comes back.
Yes, I have a question.
Yep.
When we are allowed to come up and visit my sister, are we allowed to take her to the local park, which we have always done in the past?
Not at this time.
Not this time. Okay.
No. We understand all this, but we're held to the standard of the guidance of OPW. And really, for our people to go out into the community, what the guidance says right now is you're really technically only allowed to go out in the community if they have a medical appointment or if they're employed and required to go to work.
Go to that appointment.
However, we are allowing small trips out in vans. It's not conducive for people to stay in the house all the time. And
Right.
they're allowed to go through drive-throughs. And we are allowing the staff that they're exposed to take them to a local park where there's no one else around and eat if they want to do that. But other than that, we're very limited in what we can do.
Is there any
So-
idea of when that will open back up to bring them home?
Excuse me, I didn't hear you.
I said, is there any idea of a rough time frame when we'll be able to bring our loved ones home? For
No,
visits or whatever?
I couldn't tell you at this point in time. I think that, the family visitation is the first step. I think it's all contingent upon what happens with the community right now. Are we going to have an outbreak based on the increased exposure with people milling around in the community? I think they're kind of waiting to see what happens with that. But I think the family visits are our first step, and hopefully it won't be much longer before we're allowed. I mean, they just allowed employment about a week ago. Family visits were this week, so hopefully it won't be much longer. And we'll take baby steps in doing that and put precautions in place. But I couldn't tell you right now. It's
Okay.
really
Thank
contingent
you.
upon. It's really on the governor because the governor directs OPW. OPW had a plan in place, for example, for home visitation a month ago to the governor. He just reacted to it.
Well, and I've got to say, so Howie, I think that you all have you've kept our family members so safe. So my question is, if I came and got my family member and brought her, which I think I have the right to do now, could I bring her home,
Oh,
bring her outside and then keep her there until you all determined that it was safe to bring her back? Is that
Yes,
allowed?
yes,
Do I
yes.
have to?
Yes, you can take your family member home, but you're gonna have to keep that family member home until we give permission for normalcy.
Okay. That's great to know, actually.
Howard, I think I'm unmuted now. Can you hear me
Yeah,
now?
we can.
Oh, thank you.
hey,
Okay, my question was similar to one of the ladies over here. Like when I come up to see Patty Kay, I'll only be able to see her at the house. I won't be able to take her out for a ride or anything.
Yep,
correct.
that's correct. And I know that you guys go and usually stay in a hotel or such, but at this point in time, visitation will only be allowed in the house.
In the house, and I'll be staying at a hotel, so that's not gonna
That's
impact
not
as
either.
far as being able to come in as a visitor, right?
No, you can come as a visitor. Yep.
Okay, and is there a limit on how long I can stay with her?
48 hours straight.
What do you say?
48 hours.
No, there's no limit, Ellen, as long as the family member wants to at this point in time.
Okay, so if I went to her house, I could stay there with her all day to play games with her and like that?
You could, but we're gonna probably isolate you in an area
Oh, okay.
away from everybody else as much as we can.
Okay, that's no
So
problem.
I've got a couple questions here. So Lynn's already answered one. So we're waiting for that. One of the questions was, will families receive notification when home staff are ready for visits? We should know tomorrow if we're going to be ready. And we'll put something on the website. If you guys will go to the website, we'll put it up there that what the requirements are going to be and who you're going to contact, and that we'll be able to open up for visits on Friday, or if it's going to be Saturday. But we expect right now that we should be ready by Friday with the guidance that we've received so far. Hopefully we'll receive it formally tomorrow and then we can implement that. One of the other questions was if a resident is found to be positive, we are consider isolating them in an isolation unit. I think you should just not consider it, but should implement it. At this point in time, I believe that's the direction we're going anyway. That's why we set them up, because you're really protecting everyone. It's very difficult to maintain that isolation in a residence because you have common bathrooms, and we don't have one for every person in common areas. So that's probably the way we would go, unless there was some outstanding reason why we couldn't. But that's our take right now.
Howie, can you hear me?
Yep.
Isolation.
Okay,
Positive, they
so
will.
I have a question. I'm a staff in St. Lawrence
They will.
Community Pre-Voke.
Wait.
So I guess just because I want to learn more about it, initially OPWDD, the governor, and you work together. Do you guys work together to say, look at each program individually and say, okay, can you implement the simple things of social distancing and the transportation concerns? Are you guys going to break down our programs, fine like that, so that maybe we can get in the swing of things,
Well,
and see what we have? Like, do we have something mapped out where we could do this? Like, for instance, we want to do some volunteering at campgrounds. Perfect place to do social distancing and adhere to everything else.
well, at this point in time, it's not really our opinion or our take. It's up to the OPWDD, and then it's up to the governor ultimately what he will allow to happen. At this point in time, all day services are left to those that community hab, community pre-voke, and community or site-based pre-voke and day hab are all under day services. And right now the limitations are there. We have been advocating, the ARC of New York's been advocating, self-advocates of New York have been advocating. But again, and I think the only thing we're really promoting is you need to look at it from a regional perspective too, because we're not the same as in New York City chapters in the metro area or in Buffalo. Right now the outbreaks, New York City's had the most impact. Albany's been hot, and Buffalo has had a peak, but they're starting to go back down. As of today, there's been over 400 people that we support across the state that have died as a result of COVID-19. And there's been probably about 150 staff that have died as a result of COVID-19. The metro chapters have just had a tremendous amount of difficulty. When you look at us as a field, we've really had to do stuff on our own. We haven't had a lot of support for PPE or anything else from a government entity. And we've done very well as a result of even with those circumstances. But we have to wait for guidance from OPW, and ultimately that goes to the governor and Department of Health before the approval is given to allow us to open up.
Can I just add one thing to your point, Melody? I
Yes.
would just encourage that if you do have ideas, that you jot them down and provide them to your supervisor.
Yep.
So, we have.
I've got to say, Howie, I think the numbers that you just quoted are unknown. I haven't seen those anywhere. And I think those are really, really important to know. So if there is a post that you can make that we can share that kind of makes it, I'm so impressed with how the local agencies have dealt with this, but it's so difficult. And I think it's important to share who's at risk.
Yes, so the ARC in New York has been doing a tremendous job on data collection. So we all report every week how many people we support, and as well as how many staff have been exposed, are put in quarantine, have been positive, how many have recovered. And that data has been going on for, I think, since late March, early April. So we have a lot of data, and that data is being shared with Syracuse University, who's doing an analysis. So it's been proven that the people with intellectual and developmental disabilities have a higher propensity for COVID-19 infection as a result of exposure than the regular population. So they're looking at all that data and looking at how we can improve in the future to deal with a similar situation. The metro area actually helped us out because they had the first exposure for the ARC family was early March down in Westchester County, and it was a staff member that was exposed, and actually was a staff member that had a direct link to the lawyer from New Rochelle. That actually was one of the first places that they isolated, and the exposure went out from there. They provided the rest of the chapters with a variety of information on how they dealt with the exposures, but you're talking multiple locations with positives, staffing issues, staff positive. It was a tremendous amount of work that they went through. The majority of the other chapters haven't been exposed as much as Metro. Albany a little bit is getting a little bit in Buffalo area, but other than that, across the state, and Onondaga had a little bit of an outbreak. It's been minimal across the state, but I think a lot of what happened down there helped the rest of us. But I can share some of those figures for the ARC family, at least, in regards to data collection. So a lot's being done with this to help us prepare for the future.
No, that's great. And I've been trying to track it, but I just haven't seen those figures for New York. And it's all about, I think, I want to raise awareness for who is vulnerable. So I would love to see you post those because somehow I missed all of those.
Yeah, we can just omit the parties and just have to get the figures out there and what the quantitative amounts are.
That'd be awesome. Thank
date.
you.
And the data has shown that it's definitely going down. It's the number of people that are positive, the number of people that have been exposed, the number of people quarantined are all going down dramatically from in March. So that's good news too.
Howard?
Yes.
I have one more question. When I come up to see Patty Kay, if I'm going to be staying with her at her house, can I bring in my own lunch, or should I pay my meals there? Would that be an option to pay to eat when I was there with
You
her.
don't need to pay, but we probably would have you eat with her.
Okay. Oh, I could just eat like her lunch and dinner with her at the
Yep.
house?
Yep. I mean, we are allowing, drive-throughs and things like that. So if you wanted to, the only thing is if you bring in something in front of the other people, you're eating something different, you're probably
Yeah.
going to create a war. So,
Yeah, it could be.
Something different in front of the other people, you might create a war.
Okay.
So a couple other things. So I don't know if you are aware, but in Jefferson County, we have it's called Station MD now. So we do have a physicians group that we have units set up in the houses that if we're able to call this physicians group, if someone has a cold or shows symptoms, and they will actually diagnose as high resolution video, blood pressure cuff, oxygen sensor, and the staff member and temperature. And the staff member can dialogue with the physician in regards to symptoms and provide information. And they will either send the person to the emergency room, urgent care, or if they can diagnose over the phone or over the unit, they will issue a script to the pharmacy. They also are linked in with our Thera app and will provide a note. So we just started doing that. We got a 5-year grant for that. It's being implemented in St. Lawrence also, but we're not quite ready for the technology up there. We're close to it. So we hope within the next 2-3 months, we'll have that up there also, but it's a great tool. We're also going to a nurse on call system with a nurse group. They're all professionals that are used to dealing with this field, and they have multiple contracts with the organizations. They're not going to take the place of our nurses, but they'll be there to assist so that our nurses won't have to do the on-call, the frequency that they have right now. Nurses we have a shortage of nurses in Jefferson, and we're okay in St. Lawrence, but it's very difficult to fill those positions, and we want to make sure that we make it more appealing to nurses that are looking to come into the field, at the same time meeting the needs of the people that we support. I just want to tell you a couple other things. So, New York State's having tremendous fiscal issues as a result of COVID-19, and even before that. So today on the Arc of New York call, we were informed that revenues in New York State are down $13.2 billion compared to budget. So we have received notification that they're looking to do a cut to our residential program starting in October of this year. And what we're looking at for impact is a $500,000 impact a year. So just a couple things that they're taking away. We have therapeutic leave where people can go home and visit with their family members and go on vacations. And then historically, we've been allowed to get paid for our daily rate while that's happening. They're going to allow therapeutic leave still, but they're going to pay us half our rate. Vacancies for in our residential system, they've made adjustments at the end of the year up to 5%. That's being eliminated effective October. And the other thing is we're allowed what they call retainer days, 14 days in a hospital a year. They were paying us our full rate for up to 14 days. They're going to allow 14 days, but again, cutting the rate in half for those 14 days. That translates into a $100 million impact to the ARC chapters, and it's going to hit us about $500,000. There's a pushback on it. We have to the end of the month to respond to that, and we're asking for that to be looked at. At the same time, they're giving us a 2% trend January 1st for our direct support professionals, which we implemented, and 2% April 1st, which we implemented, and basically that's being erased after we put the money out to pay those increases. So it's going to be challenging.
So can you share the links to like the information on what those actions are?
Yep.
Please, because I'm out of state and I need to follow it. So thank you.
Yeah, I'll put that on the website, do a synopsis of the impact that's being projected. And the other thing, just, I don't want to get into funding a lot, but it's been fairly good since the March 18th to April 16th, I believe it is, or 17th, I can't remember off the top of my head. We were funded 100% for all those programs that shut down. From April 17th on, they're funding our day hab units at 80%. We are able to make up 20% by providing services, but we can't provide services to people that don't reside with us, that are still home with their families. And up in St. Lawrence, we have a large number of people in day hab that live in state operated facilities or from other providers or live with their family members. In Jefferson, it's just the opposite. We have most of our people in our day hab program live in our houses. We have a small contingent that live home with their families. So St. Lawrence is going to be hit harder in regards to lost revenue in this regard than Jefferson will.
No, I gotta say, Howie, like, because I'm out of state and those kind of data, if you can share those, and it's not political, it's not, you know, I don't know those numbers. So if you can share those, that would make a huge difference to me. I would really appreciate it.
Yep, we will. I'll put all that on the website so people have access to it.
Thank you.
Yep.
What's the address again for the website?
Michelle?
We'll put it in the chat box, Howie.
I'm unmuting,
Oh,
but I'll type it in so everyone can see it.
thanks, Michelle.
So there's a question up here. One second. Do you have a lobbying group in Albany? Is there a contact person to address such cuts with directly to raise awareness of government level? So we'll provide all our local legislators on that webpage that you can contact. They're all aware of the cuts. They're all very supportive of the organization. In regards to lobbying, we do have, the ARC of New York does have people on staff that provide, that's part of their duties, responsibilities. But we also belong to a larger group called NIDA, New York Disability Association, which is all the providers in New York State, not just OPWDD, the OMH and the OASIS, Office of Alcohol and Substance Abuse. They're all getting together because we all have common issues with regards to funding. You know, before COVID hit, we were looking for 3% trend for 5 years because we've been underfunded for so many years, but COVID has impacted that directly. Over the years, we've tried to be fair to direct care, but I think we've kind of beat that to death, and it really doesn't help the organization, and it also doesn't allow us to reflect all the staff. It only hits the direct support professionals. So that is a very strong group that is now coming up with a plan to advocate with Albany. That does have some power.
We're new to the ARC, and we're not on a video. So could someone say the address for the website?
Yes. So it's www.thearcjslc.org.
And is it DOC or is it just ARC?
Is it what?
Is it the ARC or just ARC?
It's www.thearc.
Okay, the ARC.
JSLC.org.
And if any of you are on Facebook at all, we have an agency general page where we get a lot of information out when critical issues happen, but we also have an advocacy Facebook page, which is specific for people we support and their families. And on that page, we really get into the nitty-gritty of things that are going on. And really most importantly, we would love to be able to access people to give them information through email. So if you could provide us with that information and say that you're interested in it, we'd love to get in touch with you as often as possible about these critical things that are going on.
So
who do we contact?
Who do we contact for that?
I can, do you need me to say my email address or do you want me to put it in the chat box?
If you go to the bottom of your screen, there's a chat box there you can click on. And
we're just on a phone.
Okay,
Okay, so it's MQUINELL at slnysarc.org. And I'll write it
Okay.
in the box as well.
And how do we find you on Facebook?
The ARC, Jefferson St. Lawrence. If you search in the search box for that, we
The
should
ARC,
come up.
the ARC Jefferson St. Louis?
St. Lawrence.
Oh, St. Lawrence, okay.
Yep. Thanks.
That's the Facebook thing.
Yeah.
okay, so any other questions? Anybody, any of the directors want to talk a little bit about something going on in your program or?
Howie, there is a question about day hab for people that reside at home. It's in the chat box.
All right, so people who live at home with their family, those are people that we're going to concentrate on, because the other people that are in the houses, we can still provide some day hab services there. So bringing those people back, there are options right now. We can't go do direct services so much, but I know up north in St. Lawrence, we have allowed our children and youth to go pick up a family member at a time and bring them to a location to provide some services. We're willing to go out and get groceries or assist a family member if they need help there. But right now, direct services are very limited in regards to what we can do in the community because of the exposure. But as we reopen, those are the people we're going to concentrate on. If the family member is comfortable with them coming to a site-based, the site-based site will be needing to do guidance, which will be smaller. And it will deal with social distancing, and the transportation component is going to have to be dealt with. You know, the transit up in St. Lawrence, for example, we ended up limiting the number of people on the bus, going every other seat. People had to wear masks. Sanitizer had to be available. We actually put plexiglass around the driver. Some of the buses are looking at putting plexiglass between the seats. So those are things we have to look at as we reopen and safely bring people back to services and supports. You know, there's always going to be a place, I believe, for site-based day hab. There's a certain number of people that's going to appeal to, and they need that environment. And also those people that are in clinical services, the clinics are located in those day hab locations. They'll be the people that'll be most conducive to going back to that environment. But we're also looking at the integrated model at the homes for some locations too. And of course, one of the other things that's been unique about this experience is that we have a lot of our support staff are working remotely, and it's actually worked out very well. Getting things done, it's good for them, and it appears to be, you know, it might be something we'll look at as we move forward to reduce some of our brick and mortar that we rent space for those support staff, and maybe go more to that model.
So how
Do you have any idea when things are going to get back to normal?
Never. Then they'll never be back to the old normal. It's gonna be not for a long time, and I think OPW is looking at this, you know, as the need for smaller environments with more social distancing and meeting those needs is being looked at across the state. I just think it's an opportunity to move to a different model of service. I think there'll be more people that might want to go the self-directed route, and you know, we do operate that where people have their budget, we hire staff, we manage the staff, and I think there'll be more of those smaller group opportunities like community hab, community pre-book, instead of the site-based day hab. But there'll always be a place for those programs. This might not be as large as they are right now or look the same.
Howie, do you think there are concerns, for example, if we picked up a family member and took them out of state and then tried to bring them back later when things were somewhat safer?
No, there's not an issue with that either. The only thing is, again, you'd have the restriction on bringing them back. They have to go through a period of isolation when brought back. right now, any of our staff, we're putting in place, if they travel out of the county in an area that's hot, or if they go out of state, they're going to be, there'll be a 7-day quarantine when they come back. If they go out of the country, it's a 14-day quarantine when they come back.
Okay, that's good to know. Thank you.
Howie, do
Yes.
you have any idea of possible changes that they may want to the site-based pre-vote?
The site-based pre-vote? I don't think once they open up, I don't think we're going to have a big issue with site-based pre-vote. I think both of our manufacturing facilities are big enough that we can do social
I think we
distancing.
got everything we need.
And
That's what I was thinking.
there's not a lot of people that work in that environment.
can
So
listen to it
I
as they
think
drive.
we won't see a huge change there once we're able to bring those people back.
Oh, thank you.
Yeah, no, we'll hang up then, but I think it'll be over. by
Well,
then.
and the work centers, even though they've been, kind of closed, we're still having contracts. We're still working with building other contracts. Up in St. Lawrence, we're looking at, we've been working with one of our vendors. We're going to be repackaging number 5 and number 10 cans of fruits and vegetables. So that's in the works to happen. Right now, restaurants and larger vendors cannot buy a variety pack. They have to buy a single case, and some of them are interested in buying variety packs. So we're going to make variety packs of those fruits and vegetables for the vendor. We're also looking at repackaging garbage bags through NYSID, New York State Industries for Disabled, and we're looking at repackaging mop heads with a relationship with Hilliard. The other things that we are, for sanitation purposes, we are looking at buying electrostatic guns that put electrostatic charge on a disinfectant that adheres to a surface. We use them in our federal contracts. We've ordered several of those for both counties to use in our larger settings and periodically do cleaning in other locations, such as our buses. So, a variety of things that we're looking at. But the work centers, I think there are some work centers across the state that are looking at closing now that haven't closed previously. So we're hoping that'll drum up more business for us. Because we feel very strongly that the work center integrated model should be there for the people who can't work in any other environment.
Howie,
Yep.
it's Chris Schneider and David's here with
I'm
me.
right here.
Hi,
Good
David.
evening. Hi.
And you haven't mentioned anything about Production Unlimited. I assume it's just a matter of waiting until the governor says it's time to open it again.
And we might be going to see my.
Unrelated.
Yes, you're correct, Chris. We're just waiting for guidance. But again, once we get that guidance, it's not going to be as much of an issue to reopen because of the size of the building and the limited number of people that are in there.
Okay, thank you.
Thank you, Howie.
You're welcome, David. Okay, any other questions? Any directors that have anything they want to say?
Howie, there's just one other question in there about the St. Lawrence day hab and community pre-vote. If people don't reside with us, that is a concern. So that was just brought up in the chat box, and we do recognize that. So those would be the first people that possibly return to programming.
Right.
Hello. I don't know if you can hear me. I don't know if somebody fools around with this program. The prompts at the bottom, when they leave a message, it doesn't stay on long enough to read it. So I don't know if that's just a setting on the program where somebody types in a sentence, it only lasts for like 2 seconds and it's gone.
You click on the chat box, you'll be able to see what everybody's put in there. You can scroll up and down on it.
Yeah, go into the chat box on the bottom.
Okay, at the bottom of ours, it's a phone. It doesn't have a chat box. It says participants and oh, maybe under more, huh? Okay, maybe under more. Yeah, because by the time it comes up, it disappears.
We are recording this so that it'll be available for people to go back and review as well.
Okay, and you're right. I just got chat. I got it.
Okay.
Thank you.
So we'll put up on the website some of the information we talked about today. We'll put up their contacts for our legislators. We'll put up some statistics about what's happening across the state with the ARCs. Once we get the guidance from OPW, which we should have tomorrow, we'll put that up there with a notification on when visits can start and who you should contact to set up those visits.
Thank you all.
Howie, I think we should also post these questions and our responses that came up in the chat, because those are good questions as well.
Will those show up in the recording also, Michelle?
Yes. Oh, good.
Now, I've got to say, Howie, like, this is such a valuable, open discussion that I really, really appreciate. And it makes me feel so much more comfortable about what's happening in the system at a time where we can't really see what's going on. And so I truly appreciate it.
So I guess my question to all of you is, how do you feel about returning to a site-based program?
I don't know. I mean, there's so many things that have to be considered, and so many of the people are, compromised medically, and son is one of them, and so I prefer to err on the side of caution. So
I do also.
Most of us do.
I do also. Patty K is the love of our life, and I want her safe.
Yeah. Safety
Well,
first.
I have to say that for my sister, I really feel like the social part of it is so important. And so if somebody put a mask, if she was given a mask and gloves, like, I feel like that would give her so much quality of life that without that, if she can't see her family and things, like, I think the risk is worth it.
Yeah, I mean, so once we reopen, that may be one of the things we will try to do is not only will the staff have to wear a mask, the people we support, the ones that will tolerate it, will also be provided with those with masks.
No one, and I think that if you pose it to them, I mean, obviously, all I know is my sister, but in the context of, being able to socialize with people outside her house who may or may not be people that she wants to see, frankly, I think that's a really valuable thing.
Anyway.
Yeah, so I mean, there's innovative things that are taking place across the state, and some of the things we may look at if this goes on for a little while is that looking to provide some type of service for people in the community. What they did in Cattaraugus is they took a bus, they took seats out of half the bus, and they made an activity area out of it. And they go to locations and bring one or two people at a time onto the bus to do activities in a safe environment, using the same practices we do everywhere else. And then they clean it all out and go to the next location. Just for some options for people, provide a different environment, provide different activities. But again, I would say our staff have done a good job of, the behavior staff, the QIDPs, of providing supports and providing activity boxes to the people we support in all the environments, just to give them something else to do. We are, IT is, we're working on it in St. Lawrence. We're almost there. We've spent since the middle of last year to this summer, $600,000 in IT in St. Lawrence County. So we're working to upgrade everything. All the houses are being upgraded for fire systems, security systems, and IT. So we're getting there.
Howie, is there any way that we can do? Can we do an
I'm on a Zoom meeting.
Can you do what?
I think what's helped us out a lot is the being able to video chat and FaceTime with our son, and that's helped a lot.
Love you, bye.
Yep, so we've been trying to do that with some of our sites. And IT is, devices and IT is an issue in some locations, but where we can, that's what we've been doing, besides phone calls.
Howie, can you do GoFundMe for like specific needs that you have in Jefferson and St. Lawrence County? Is
Well,
there a way to do that?
I don't think we're at that point right now. We're doing okay, and we both have active foundations, both in Jefferson and St. Lawrence. So any unmet need that we are not able to address, we go to our foundations and ask for support. I don't think we're at that point in time where we need anything. We're still a healthy organization. We're in good fiscal condition, and there will be an impact here, but doing okay.
Howard, I know on Amazon.com, they have a program. In fact, I use it if I buy something from Amazon, and a certain amount of what I buy goes to the Jefferson ARC, I believe it is, through Amazon.com.
Yep, Michelle's got that set up.
Yes, we have an Amazon Smile link so that if you log in through Amazon Smile rather than the standard Amazon, a portion of your purchase will be donated back to the JRC Foundation. And just to add to what Howie was saying, although we don't necessarily need donations for personal protective equipment and things pertaining to COVID, your donations are always impactful when it comes to the things that we're doing within our organizations. Both our foundations look to give back directly to the people we support for things that their insurances don't cover. And we also help the agency with larger things. Like many of you know right now, we are still looking to raise another $1 million for the renovation of our main services building, which is going to be crucial to our programming moving forward for the next 50 to 60 years. So your donations are truly appreciated, and you can always reach out to myself or Michelle in St. Lawrence County if that's something you're interested in doing. But thank you, everybody who's participated and supported in the past.
So I think another side to this COVID-19 is I've never seen the building so clean. So we've gone through and cleaned out all the buildings, waxed the floors. I mean, it's just, we never had time to do that. They look fabulous. So we're ready to reopen when we get the go to reopen. Okay, so we'll have a notice out. We will try to set up another meeting in a couple weeks and see where we're at and provide some more information. We'll start doing this on a regular basis. Think about questions you might have between now and then. Any ideas or suggestions, we're more than willing to listen to and try to abide by. And we're only as good as the support we get from the family members, the people we support. So thank you for all your support.
Thank you, Howie.
Thank you.
Thank you.
Okay.
Thank you.
Have a good evening, guys.
You too.
Thank you.
Thanks again.
Good night.
Good night.
Good night.